Our client is Children's Hospital of Pittsburgh of UPMC. As a part of a hospital-wide initiative to improve patient flow, Children's Hospital has tasked our team with producing recommendations with regards to standardizing and improving the rounding process, improving communication between teams in the hospital, and determining practices that can be applied across the various hospital teams.
We collected data over a 4-week period in 2 different departments. One of these departments was the General Pediatrics department and the other was the surgical department. On the screen beside me you can see our data collection sheet for the General Pediatrics department. From this sheet we got how long each room we were spent in each room, what happened in each room. We got the message board utilization, if the nurse was paged or not, similar items like that. We also had a sheet for the surgical department, but as we were shadowing, we decided it was easier just to write notes and take times that way. So here's a summary of all the statistics that we collected over the period. There were similar minimum times in both the pediatric and general surgery departments, but the main thing was the average times for the rounds in each department. The average time for the general pediatric round was 8.4, while the average in the surgical department was 1.6 minutes. So this is a very significant difference here. And you can tell that by the number of data points that we collected, where in surgical we collected 114 and in general pediatrics we collected 59 over a similar time period. So here's a summary of our statistics from last year's project to what we observed this year. They have pretty similar statistics, except for the averages are slightly different. We attributed this to them implementing the process just recently, so they're just getting used to it. We look for these numbers to decrease over time.
Moving on to a qualitative analysis of our project. On the screen you will see a flow process diagram for both the general surgical and pediatrics teams. These flow process diagrams are a step-by-step hierarchical breakdown of the processes and will be used as a visual for us to draft our recommendations and a visual for the hospital to see where these recommendations will be implemented. On the screen you now see an efficiency and communication fishbone diagram. These are both broken down into 4 root causes and act as a visual breakdown and how it relates to the inefficiencies within the rounding processes.
So next we'll move on to the recommendations portion of our project. There's 4 quadrants that we've sort of developed these recommendations into, and they're based on the ease of implementation and also the value adding of these recommendations, as you can see on the screen below. But besides that, we've also split them into 3 main groups. So the first group are recommendations that have to deal with the presentation aspect of rounds. So these include using the one-liner during pre-rounds, focusing on diagnosis in the room where possible, not leaving gaps in the presentation during the rounds, combining the pre-rounds and the rounds where the residents and med students feel comfortable, and also utilizing the time between patients more efficiently. So while you're walking between rooms, talking about that next patient. Next, we move on to quality initiatives. So these are things like paging the nurse for every room, using the whiteboard in every room, having a briefing for the med students and the residents on the first day of each rotation, and also just using Cerner and the EHR for every patient in every room every time. And lastly, we move on to recommendations that have to deal with scheduling and staffing. So these include moving the teaching morning report to the afternoon, making checkups, which is like the red students and the med students, their interaction with the patients, move that right before rounds instead of having this gap in between, splitting each team into smaller groups, presenting better estimates of the rounding times for the patients, implementing a turn policy during the rounds, and then lastly, the last 3 are to make the overlap of the attending switch more efficient, having nurses be specific to each room or each wing, and finally having the subspecialties or the different specialties round simultaneously.